Essentially, a rhinoplasty is a surgical gesture that changes the shape or form of the nose. Very commonly, that will mean removing a bump or a hump on the dorsum of the nose that may interfere with dorsal profile. It may relate to a tip which is seen to be disproportionately big or lacking in definition. It may have something to do with nostril size. It may have something to do with the overall shape and size of the nose in relation to the face. There are two main types of rhinoplasty procedure. The procedure can be carried out closed with incisions on the inside of the nose, or it can be carried out as a so-called open rhinoplasty. There is an incision on the external skin of the nose, but it's extremely well hidden under the columella. An open rhinoplasty, it is said, gives a little bit more precision about correcting nasal features, and actually I do prefer the open technique and use it for about 85% of all patients having a rhinoplasty. There are some people who are psychologically unsuitable for rhinoplasty, and it is essential that a very careful assessment is made of the reason for rhinoplasty. For the vast majority of people, this is very simple and straightforward, but there are a number of quite severe psychological conditions which express themselves through a need to have change in body or facial proportions, and those patients will not be helped by rhinoplasty. A rhinoplasty will usually take about an hour, but they can be quite complicated, and some rhinoplasties may take 2 or even 2.5 hours. The procedure is carried out under a general anaesthetic. No surgeon should say that everything's easy and that there's nothing without discomfort, but I do tell all my rhinoplasty patients that they won't be hurt by the procedure. The way in which the bone is now broken is with a tiny, tiny osteotome that is really like a sort of engraver's instrument, which is only a couple of millimeters in width, and it really is to tap the nasal bones with very, very little in the way of collateral bruising. For any rhinoplasty with any significant work done, there's a splint placed afterwards. The big white plus of Paris splints are a thing of the past, and we now use little acrylic moulded splints. You have to wear that splint for sort of 7 to 10 days, and for that time it's pretty obvious that you've had a nasal procedure. So I think for anybody that's had a rhinoplasty, they're really looking at 10 to 14 days off work. I often say to patients that after rhinoplasty, it's very unlikely that people are going to say, "Oh, what a beautiful nose you've got," because that's not really what we notice when we look at the face. But for many people, their friends and family will say, "Wow, you know, your eyes look fantastic," or you can see your lips, or some other feature. And the key to that is that if the nose is put back into proportion with the rest of the face, it allows all those facial features to be seen instead of the nose being the dominant feature of the face. I think the critical thing about a rhinoplasty is that the nose should look unoperated. The surgeon's hands should not be visible when you look at a nose. It should look natural. It's the nose that the face deserves, or the nose that fits the face.